Hi, my name is Jen, and I'll be your provider today. Could you please state your name and date of birth for me? Thank you. So I understand you came in today with some shortness of breath. So we did find some fluid built up on the left side between your lung and your chest wall, and that could be contributing to your shortness of breath. So what we would like to do is a procedure called a thoracentesis, which is actually removing that fluid and sending some of it to the lab so that we can run some labs and figure out why it's there and how best to treat you. The procedure involves numbing the area and then inserting a needle through your chest wall just inside it into that area where the fluid is, and then removing the fluid. Risks involve bleeding. We did notice that you're on a blood thinner, warfarin, so we'll check the INR before we do it and make sure that it's not too high. Other risks include air going in to that area. All of these are quite rare, but other risks do include traumatic injury from the needle to your lung, possibly your liver or your spleen. Again, quite rare. We put a dressing over the area. You might notice some bruising. It might be a little tender. And of course, there's always the risk of infection. Alternatives to the thoracentesis would be not doing anything, not removing the fluid, and kind of doing supportive measures to see if your body would resolve it on its own, although it sounds like this has been going on for a while, and I think that might be a riskier approach, and also it wouldn't give us the diagnostic information we need to be able to figure out why it's there in the first place. So I just gave you a lot of information. Would you mind just repeating it back to me so that we can make sure that you've understood it, and that if there's any questions, I can clarify it for you. And then after we've had a chance to discuss it for a little while, I did bring in a consent form so that you could sign that and we could move forward with the thoracentesis. Thank you.